So with sodium, the normal levels are 135 to 145 milliequivalents per liter. From that, you can have hyponatremia or hypernatremia. And with hyponatremia, you can have a fluid and electrolyte imbalance, and it can cause cerebral edema. The water retention by the kidneys also helps with hyponatremia because there's not enough sodium per amount of water. And some signs and symptoms of that are nausea, vomiting, headache, confusion, seizures, and irritableness. And you also have muscle weakness, spasms, or cramps. And then with hypernatremia, that level is 145 milliequivalents per liter or higher, and it is caused by a decrease in water or increase in sodium. So again, with that, you will have a fluid and electrolyte imbalance. It can be caused by diuretics, SSRIs, and antidepressants. And you have thirst, restlessness, fatigue, altered mental status, dry mouth, tachycardia, and insufficient urine production. And then with chloride, you can have hypo or hyperchloremia. The normal levels for chloride are 97 to 107 milliequivalents per liter. With hypochloremia, the level is below 97. It is low chloride levels in your bloodstream. Some signs and symptoms of that is fluid loss, dehydration, weakness or fatigue, difficulty breathing, diarrhea or vomiting. It can be caused by the use of bicarbonate, corticosteroids, diuretics, and abuse of laxatives. Chloride works with sodium and potassium to regulate the fluid and the pH balance in your body. With hypochloremia, that's above 107 milliequivalents per liter. It's abnormally high levels in the bloodstream. Some signs and symptoms of that are fatigue, muscle weakness, excessive thirst, dry mucous membranes, high blood pressure. It can be caused by chronic or acute kidney disease and high levels of salt in the body. The medical importance for this is that it's sometimes not noticed until a blood test is done. So some of the symptoms are asymptomatic and can be diagnosed for other things. So now I'm on to potassium. Potassium's normal level is 3.6 to 5.2. You have hyperkalemia, which is above 5.2. It has kidney dysfunction, diseases of the adrenal glands. Your potassium could be going outside of the cells into the bloodstream, and by taking certain medications. Some signs and symptoms of this are fatigue, nausea, muscle weakness, tingling sensations, slow heartbeat, and a weak pulse. People with kidney dysfunctions are especially sensitive to medications that can increase blood potassium levels significantly. And then we have hypokalemia, which drinking too much alcohol, poor potassium intake, excessive sweating, vomiting, diarrhea, and kidney disease, and again, adrenal disorders can cause this. Some signs and symptoms are weakness and fatigue, heart palpitations, muscle aches, tingling, breathing difficulties, mood changes, and digestive problems. Low potassium helps your muscles, can affect the way your muscles move and cells get their nutrients and signal nerves. I have a story for this. My father suffered from adrenal disorders. He had a cyst on his adrenal gland, and during one of his doctor visits, they took his levels, and on his way home, he got called by the doctor saying his potassium levels were below 2 and that he needed to get to the hospital right away and get that fixed. But, as I said, some of these symptoms could be misdiagnosed or he could be asymptomatic, and he felt perfectly fine like he did every other day. So that's just one way I remember these. And then now on to phosphate. The normal levels are 2.5 to 4.5 milligrams per DL. Hyperphosphatemia is above 4.5. Some signs and symptoms are it results from the effects of hypocalcemia, muscle cramps, tetany, and peroral numbness, tingling, bone and joint pain, and a rash. It can cause damage to your body and pulls the calcium out of your bones, which makes them weaker. The medical importance is phosphate is used to help strengthen your bones along with calcium, and it produces energy and builds cell membranes. Hypophosphatemia, it is commonly connected to starvation and alcoholism. It can show up as some signs and symptoms as anorexia, muscle weakness, seizures, and coma. And low levels of phosphate lead to anemia, which means less oxygen is being released from the hemoglobin and impaired leukocyte and platelet function. Now on to calcium. Hypercalcemia is when your calcium's above 10.2. An overactive parathyroid gland, multiple myeloma, and too much calcium can affect the brain. Too much calcium in your blood can weaken your bones, create kidney stones, and interfere with the functioning of your heart and brain. Some signs and symptoms of this are dehydration, fatigue, loss of appetite, thirst, constipation, nausea, increased urine output, weight loss, and muscle weakness. And then with hypocalcemia, your levels are below 8.5. So you can have cramping, muscle weakness, fatigue, muscle spasms, irritability, pins and needles in all of your extremities or throughout your body. You feel that. It can be caused by a lack of vitamin D. It can also signal a condition in the parathyroid glands, your pancreas, or your kidney. And low calcium levels can lead to dental changes, cataracts, and osteoporosis. Now on to magnesium. The normal level is 1.8 to 2.5. Hyper is above 2.5. You can feel weak, confused, tachypnea. You'll have decreased reflexes and low blood pressure and could lead to cardiac arrest. It carries the electrical charge throughout your body through the blood, and it affects your bones, your cardiovascular function, and neurotransmitters. And then hypomagnesemia, magnesemia is below 1.8. It can be caused by hypercalcemia or diuretics, and poor kidney function. Kidney function may also affect your levels. Some signs and symptoms are twitches, weakness, and exhaustion, nausea and vomiting, personality changes, tremors, and constipation. And a shift in potassium can cause this. It needs to be excreted through your kidneys, and if it's being held onto, it will not properly digest into your bloodstream.